Let's roll into 4 ways that our faces age and their treatments.
Okay, in general, I think when somebody approaches the aging face, they need to break it down to these 4 ways to get the best result. And the first one of those is dynamic lines. Dynamic lines you would get between the eyes, across the forehead, the crow's feet area, and those are best treated with Botox. Skin aging, 80% of skin aging is sun damage, and 80% of that skin aging is reversible. So I think, we know that most of our sun exposure comes before the age of 20, and certainly when I was younger there was no discussion about sunscreens, but the good news is that we can reverse that. Probably the easiest or simplest way to reverse it is by using creams, then it goes all the way on to deep chemical peels and in some case laser peels. The next is gravitational aging, and that's what most people are probably most thinking about when they go to see a plastic surgeon, mostly because we're surgeons, and that's, our whole face sort of falls, and as we fall, the only way to correct that laxity of that falling skin is to do a facelift or do eyelid surgery, brow lifts, and of course a neck lift. In some patients we can separate those procedures, and a lot of patients it's the best to combine them. And then the last one, I think is one of the most interesting, and certainly a growing field currently, is facial hollowing. When we're young, it's high tide. When we're old, it's low tide. So everybody gets a sense that they're falling down, but we're actually falling backwards, and our face is collapsing. So as now, that's why the filler market has gotten to be so big, because we can take an off-the-shelf filler, which will last anywhere from 3 months and in some cases up to 2 years, depending upon where it's placed. And now we've come to autologous fat transfers to restore volume permanently.